What if one of the first signs of diabetes is already happening in your body, but you are calling it just aging? Maybe you wake up 2 or 3 times at night to use the bathroom. Maybe your mouth feels dry even after drinking water. Maybe your eyes get blurry for a while, then clear up. Maybe you feel tired after eating and think, well, I'm just getting older. But here is the part many seniors never realize. Diabetes does not always arrive with a loud warning. Sometimes it whispers. It can show up as a small change in your energy, your skin, your feet, your thirst, your sleep, or even your mood. And because these changes can feel normal after 60, many people ignore them for months or even years. This does not mean you should panic. It does not mean every tired day or every bathroom trip means diabetes, but it does mean your body may be giving you clues that deserve attention. Today, we are going to look at 7 diabetes warning signs. After 60, that many seniors mistake for normal aging. Stay with me, because number 6 is especially important if you take diabetes medicine, blood pressure medicine, or sometimes skip meals. And before we begin, remember this: never stop or change prescribed medication on your own. If something in this video sounds familiar, the safest step is to talk with your doctor or healthcare provider. Number 1. Waking up at night to urinate more often than usual. Many seniors think nighttime bathroom trips are just part of getting older. And yes, there can be many reasons for waking up at night. It may be related to the prostate, bladder changes, drinking fluids late, certain medications, sleep problems, or other health conditions. But frequent urination can also be one of the early signs of high blood sugar. Here is why it matters. When there is too much sugar in the blood, the kidneys have to work harder to filter it. Your body may try to remove extra sugar through urine. That can make you urinate more often. And when you lose more fluid, you may feel thirstier. So the pattern becomes easy to miss. You wake up at night to urinate. Then you drink more water because your mouth feels dry. Then you urinate again. Over time, you may think, this is just my age now. But the most dangerous part is that it can feel normal at first. A common mistake is ignoring a change in your pattern. For example, if you used to wake up once per night, but now you wake up 3 or 4 times, that change matters. If you feel unusually thirsty during the day, or your mouth feels dry even after drinking, that is worth mentioning. A smarter step is to track it for a few days. Write down how many times you wake up at night, whether you feel thirsty, and whether this is new for you. Then bring that information to your doctor. Do not try to fix this by forcing yourself to drink huge amounts of water at night. That may make sleep worse and may not solve the real issue. Instead, drink normally, avoid very sugary drinks, and ask your doctor whether you should have your blood sugar checked. And this leads directly to the next sign, because high blood sugar does not only affect your bathroom habits, it can also quietly drain your energy. Number 2, feeling unusually tired, especially after meals. You may think, of course I'm tired, I'm over 60. I do not have the same energy I had at 30. That is understandable. Energy can change with age. Sleep may not be as deep. Pain, stress, medications, and other conditions can all make you feel tired. But diabetes-related tiredness can feel different. It may feel like your body has fuel but cannot use it properly. When you eat, your body breaks food down into sugar, which becomes energy for your cells. Insulin helps move that sugar from the blood into the cells. But with type 2 diabetes, the body may not use insulin well. So sugar can stay in the blood while the cells still feel low on energy. That is why some people feel sleepy, heavy, weak, or foggy after meals. This is where many seniors get confused. They think the meal made them tired because they ate too much, or because they are older. Sometimes that may be true, but if this tiredness happens again and again, especially after bread, rice, pasta, sweets, sweet tea, juice, or large portions, it may be a clue. A common mistake is trying to fight this tiredness with more sugar or more caffeine. You feel low, so you reach for biscuits, sweet coffee, soda, or candy. For a little while, you may feel better, but later your blood sugar may rise and fall again, leaving you tired once more. A safer alternative is to pay attention to what your body does after different meals. Notice whether you feel better after a balanced meal that includes protein, vegetables, fiber, and a smaller portion of carbohydrates. For example, instead of eating only toast or only rice, you might discuss with your doctor or dietitian how to balance your plate in a way that fits your health needs. Also, if you are already taking diabetes medication, do not change your food drastically without medical advice. Big changes in diet can affect blood sugar, especially if you use insulin or certain diabetes pills. The practical takeaway is simple. If tiredness after meals is new, strong, or happening often, write it down. Note what you ate, what time you ate, and how you felt afterward. This can help your healthcare provider understand what may be going on. But fatigue is not the only quiet sign. Sometimes diabetes shows up in a place you may never expect, your eyes. Number 3, blurry vision that comes and goes. Have you ever noticed your vision getting blurry for a short time? Especially after eating, when you are tired, or when you have not been drinking enough fluids. Many seniors immediately blame their glasses. They may think, my prescription must be changing, or this is just old eyes. And yes, vision changes after 60 are common. Cataracts, dry eyes, glaucoma, and other eye conditions become more common with age. But blood sugar changes can also affect vision. When blood sugar is high, it can change fluid levels in the eye. This may cause temporary blurriness. Some people notice that their vision seems clear one day and blurry the next. Others may struggle more with reading, driving at night, or focusing on small print. The mistake is buying stronger reading glasses again and again without asking why the vision is changing. If your vision is getting blurry suddenly, severely, or with eye pain, that should be checked urgently. And if you have diabetes already, regular eye exams are very important because diabetes can affect the small blood vessels in the eyes. This does not mean you should panic over every blurry moment. But repeated blurry vision is not something to ignore. A safer step is to schedule an eye exam and tell the eye doctor if you have diabetes, prediabetes, or a family history of diabetes. Also tell your primary doctor if your vision changes come with thirst, frequent urination, fatigue, or unexplained weight changes. And here is something many seniors do not know. The eyes may give clues before you feel seriously ill. That is why regular checkups can protect your vision. Now, the next sign is one many people notice in the mirror, in their shoes or on their skin, but they often blame it on dry weather. Number 4, cuts, wounds, or infections that heal slowly. After 60, the skin can become thinner and drier. A small scratch may take longer to heal than it did years ago. That can be normal to some degree. But if a cut, blister, or sore is taking much longer than usual to heal, especially on the feet or legs, it deserves attention. High blood sugar may affect circulation and immune function. In simple words, your body may have a harder time fighting germs and repairing tissue. This can make infections more likely and healing slower. Many seniors make one dangerous mistake here. They cover the wound, ignore it, and hope it goes away. This can be risky, especially for people with diabetes or possible diabetes. A small blister on the foot may not seem serious, but if you have reduced feeling in your feet, you may not notice it getting worse. A tight shoe, a small pebble, or a toenail problem can create a sore that becomes infected. This is why doctors often pay attention to foot care in people with diabetes. A practical habit is to check your feet every day, especially the soles, heels, between the toes, and around the nails. Use a mirror or ask a family member if bending is difficult. Look for redness, swelling, cuts, blisters, drainage, or skin that feels unusually warm. Do not cut corns or calluses by yourself. Do not use harsh chemicals on your feet. And do not walk barefoot if you have diabetes or numbness in your feet. If a wound is not healing, is getting larger, smells bad, has pus, becomes painful, or is surrounded by redness or swelling, contact a healthcare provider promptly. This is not about being afraid. It is about catching small problems early when they are easier to treat. And that brings us to the next warning sign, because diabetes can affect not only the skin, but also the nerves. Number 5, tingling, burning, numbness, or strange feelings in the feet. This is one of the most overlooked signs after 60. You may feel pins and needles in your toes, or a burning feeling at night, or your feet may feel cold even when they are warm to the touch. Some people describe it like walking on cotton. Others say their feet feel heavy, tight, or strangely sensitive to bed sheets. Many seniors think this is just poor circulation or old age. Sometimes it may be related to back problems, vitamin deficiencies, thyroid problems, medication effects, or other nerve conditions. But diabetes can also damage nerves over time, especially in the feet and legs. The tricky part is that nerve problems can start slowly. At first, it may be a mild tingling. Then you may notice numbness. Later, you may not feel pain from a blister, cut, or burn. That is why this sign matters so much. The common mistake is waiting until the numbness becomes severe. Some people only mention it after they start stumbling, losing balance, or developing foot wounds. A smarter step is to bring it up early. Tell your doctor if you have tingling, burning, numbness, weakness, balance problems, or pain in your feet. Ask whether your blood sugar, vitamin B12, thyroid, circulation, or nerve function should be checked. If you already have diabetes, ask how often your feet should be examined. Your healthcare provider may check sensation, pulses, skin condition, and footwear. At home, choose comfortable shoes with enough room for your toes. Check inside your shoes before putting them on. A small stone or folded insole can cause damage if your feet have reduced feeling. And be careful with heating pads or very hot water. If your feet are numb, you may not feel a burn until it is already serious. Stay with me, because the next one is different. So far, we have talked mostly about high blood sugar, but diabetes care can also involve another danger: blood sugar going too low. Number 6, shakiness, sweating, dizziness, confusion, or sudden weakness. This one is especially important if you already take diabetes medication, insulin, or pills that can lower blood sugar. Low blood sugar can sometimes happen if you take medication and then skip a meal, eat less than usual, exercise more than usual, drink alcohol, or have changes in kidney function or medication timing. It can also happen for other reasons, depending on the person. The symptoms may include shakiness, sweating, fast heartbeat, hunger, dizziness, weakness, headache, confusion, irritability, or feeling like you might faint. But in seniors, low blood sugar can be especially confusing. It may look like a panic attack. It may look like sudden weakness. It may look like a memory problem. It may even look like a stroke or a fall risk. The most dangerous part is that some older adults do not feel the early warning signs clearly. They may not feel shaky until the blood sugar is already very low. A common mistake is saying, "I just need to lie down," without checking blood sugar. If you have a glucose meter or continuous glucose monitor. Another mistake is taking diabetes medicine and then delaying breakfast or skipping dinner. If you have diabetes and your doctor has told you to monitor your blood sugar, follow that plan. Ask your doctor what number is too low for you and what you should do if it happens. Many people are taught to use fast-acting carbohydrates for low blood sugar, but the exact plan should come from your healthcare team. Also, family members should know the signs. If you live with someone, tell them what low blood sugar looks like for you. Keep your emergency instructions easy to find. And here is a very important reminder. Do not stop your diabetes medicine because you are afraid of low blood sugar. Instead, discuss your symptoms with your doctor. Your dose, timing, meals, or treatment plan may need review. This is one of those topics where a simple conversation with a healthcare provider can prevent serious trouble. Now, the last sign may surprise you because many people think diabetes always causes weight gain, but sometimes the warning sign is the opposite. Number 7, unexplained hunger, cravings, or weight changes. Many people believe diabetes is only about eating too much sugar or being overweight, but the truth is more complex. Some people with high blood sugar may feel hungry often because their cells are not getting energy properly. Others may lose weight without trying. Some may gain weight because of cravings, tiredness, reduced activity, or other factors. And some may have diabetes with very few symptoms at all. After 60, unexplained weight change should never be ignored. If you are losing weight without trying, especially with thirst, frequent urination, fatigue, or blurry vision, speak with your doctor. If you feel hungry soon after eating, or if you crave sweets strongly in the afternoon or evening, pay attention to the pattern. This does not mean you should blame yourself. Diabetes is not a personal failure. It can be influenced by age, family history, weight, activity level, sleep, medications, hormones, and how your body uses insulin. The mistake many seniors make is going on an extreme diet without medical guidance. They remove all carbohydrates suddenly, skip meals, or follow advice from a friend or a video without checking whether it is safe for their situation. This can be risky, especially if you take medication. A safer approach is to focus on steady, balanced habits. Eat regular meals if your doctor recommends it. Include protein, fiber, and healthy foods that keep you satisfied. Reduce sugary drinks and large portions of sweets. Walk or move in a safe way if your doctor says activity is okay for you, and ask for personalized advice, especially if you have kidney disease, heart disease, digestive problems, or take several medications. The goal is not perfection. The goal is awareness, because after 60, small daily patterns can tell a big story. Now let us bring all of this together. Diabetes warning signs can be quiet. They may look like normal aging at first. More bathroom trips at night, more thirst, tiredness after meals, blurry vision, slow healing cuts, tingling feet, dizziness or shakiness, weight changes, strong cravings. These signs do not always mean diabetes, but they do mean your body may be asking for attention. The best thing you can do is not panic and not ignore it. Start by noticing patterns. Is this new? Is it getting worse? Does it happen after meals? Does it happen when you skip meals? Is it affecting your sleep, walking, vision, or daily life? Write it down for a few days. Bring it to your doctor. Ask whether you need a blood sugar test, A1C test, medication review, foot exam, or eye exam. And please remember this: never change or stop prescribed medication without speaking with your healthcare provider. Diabetes care is personal. What is safe for one person may not be safe for another. Your body is not betraying you. It is communicating with you. After 60, paying attention to small signs can make a real difference. A symptom caught early may be easier to manage. A wound checked early may heal better. A blood sugar problem found early may help you avoid bigger complications. So do not dismiss repeated warning signs as just age. Age may explain some changes, but it should not be used as a reason to ignore your health. Talk to your doctor, ask questions, check your feet, protect your eyes, notice your energy, and treat your daily habits as part of your health care. Do not forget to like and subscribe. See you in the next video.